Thank you very much. Breast cancer awareness is observed every October of the year, not only in Nigeria, but globally. This pink symbol is chosen because it represents support, strength, unity, and hope for those affected by breast cancer. Therefore, that is why today, being a very important day, the Breast Cancer Awareness Day, that is why wherever you turn around, you will see pink. We are doing this in solidarity for people affected with breast cancer. The primary aim of today is to create awareness. The campaign is strictly to create awareness, raise awareness in the community about breast cancer, also promote early detection, which is very, very important, and also support research and treatment efforts. And therefore today, we are going to try as much as possible to provide information on signs and symptoms of breast cancer, risk factors of breast cancer, and the need for early screening, and then some preventive measures. I am sure the presenter is going to do justice to all this information. Reason is because this awareness is very, very key and important in cutting down the burden of this menace, breast cancer. If you educate the society on breast cancer, they will have the knowledge and then be empowered with the knowledge to know when to come and seek for medical help. It will also go a long way to reduce the stigma among those affected with breast cancer, and therefore they will feel free to seek for health assistance as early as possible. It will also serve as a means of support to our sisters who may be affected with breast cancer. Without taking much of your time, I'm sure the presenter is going to say so much on that. So permit me to invite the chairman of this wonderful occasion, Dr. Marwa, to come forward for an introductory note.
All heads of departments, colleagues, good morning. Welcome to today, which is the Jalingo Go Pink Day 2024. This and the reason why we are here is part of the global effort to raise awareness on the scourge of breast cancer. And also, just as the MC have said, early detection is the key. That's the key word. We know that in breast cancer in Africa, Nigeria, and in Jalingo, most of the patients we have, they present late. As such, the aim of management is usually palliative. And by palliative, we mean just to improve the quality of life of those patients. But the aim of this particular program or this particular campaign is to identify this disease early. Hence, over 90% of these patients that are identified early, the aim of management is cure. But mind you, I'm sure you'll be wondering what is cure in breast cancer. Cure means this particular group of patients will have 5 years free of the burden of the disease. Just 5 years free of the burden of the disease. But this means a lot, because if you have seen how somebody suffering from an advanced breast cancer here in the hospital especially, what they go through is something else. The World Pink Day was started initially in Ethiopia by the WHO Ethiopian Staff Association, that's WEMA, in the year 2015, particularly in November. Then their effort was to raise awareness on self-breast examination, hence early detection of the signs and symptoms of breast disease. So this was subsequently adopted by the WHO, and that's the reason why we are here. And part of the reason why we are here is that the Federal Ministry of Health and Social Welfare, particularly the Department of Hospital Services, have urged all the MDAs to actually raise this particular campaign on Go Pink Day. This actually came timely because the Department of Clinical Services were also preparing to do something of such. So thank the Federal Ministry of Health, thank our proactive medical director for really making this day possible. So also thank all of you that have found time. I know today is Saturday, most of us are farmers, most of us have various activities to do, but we deem it necessary, not because of anything, but because to raise this awareness on early detection and possible cure for breast cancer patients. Thank you so much. Our activities are lined up, as you can see in the program of events. I hope all of us are ready. Thank you very much and welcome.
The hospital here present, everyone here present, good morning. I'm indeed happy to see all of you here this early. I have to join the MC and the Chairman Local Organizing Committee in apologizing for the reversal of the program. We were directed by the Minister of Health to make this big, to turn the hospital pink, to ensure that all departments are pink and all of us appear in pink. So to achieve that, we ordered for T-shirts to come in from just with inscription and the theme of the day. However, the T-shirts are still on the way. So we decided to at least hold the lectures first, hoping that in an hour or so the T-shirts will be here so that we can all wear them and paint the town pink. So thank you all for adapting. This shows your resilience and your ability to make sure that situations are turned into positive events. Thank you for being here today. So I don't have much to say. The chairman has said what this day is all about. It's a day meant to create awareness on breast cancer through early detection by screening, self-breast examination, and of course, early visiting. Apart from early detection, we are also interested in focusing attention on diagnosis, treatment, and also research. Research is very important in breast cancer so that we'll be able to come up with cure at least, so that people that have been affected, okay, either through acquiring the disease or knowing someone who has acquired the disease, can be positively impacted. So we, as a tertiary healthcare, will go through all the gamut of early prevention, treatment, research, and even teaching. So this day is meant to create awareness mainly to the public and also bring us together so that we can honor those that have been affected, their relations, our mothers, our sisters, our daughters, some even our fathers, because breast cancer can also affect males as well. So this is a very, very significant event to us, and I'm happy you're all here to celebrate it with us and to honor those that have been affected. So without wasting too much time, I don't want to give a lecture because where is the guest lecturer? At the back. Because the guest lecturer, I'm sure, will do justice to the topic. So I hereby declare this open and thank you all for coming.
Please, another round of applause for our proactive medical director. Now, we sincerely appreciate you, and we are strongly behind you as you continue to drive the institution to a more greater height.
MC, the Chief Medical Director of FMC Jalingo, the CMAC, ably represented by his deputy, who is also here in his own capacity as the deputy CMAC along with his colleague, the Chief Accountant, the HOD nursing, all HODs here present, ladies and gentlemen. You are welcome to this presentation on breast cancer as we mark this World Go Pink Day. With your permission, Ma, let me come on to the high table. Thank you, Ma. Yes, so the issue of breast cancer is something that has ravaged almost every family in this country and the world over. Even within our community here in FMC Jalingo, we have had a lot of friends, colleagues, sisters, and mothers that have been affected with this. So the topic will just be straightforward. Of course, I'm surprised that it is not the commonest cancer in the world. It has, by the way, this data is by WHO 2022. As of then, when they got this data, respiratory cancer have exceeded breast cancers. But it is just because of the incidence in some few advanced countries that skewed the data away. But in most countries worldwide, breast cancer still stands as the most common cancer in more than 95% of the countries. Okay? It accounts for over 2.3 million cases in 2022. In fact, previous data have also shown similar figures, and a mortality of over 660 individuals. Here in this country, it accounts for over 25% of the cancers diagnosed. The figure is over 32,000, and we believe it's actually much more higher than this because we do not really have a lot of data, and most of the people do not even present to facilities where they can be captured. So we believe this figure is far higher than what is being recorded. And we have deaths of over 20% of all cancers in the country. Over 16,000 people in 2022 died because of breast cancer. So the risk factors for breast cancer, of course, one of the greatest risk factors is being female. It is not a big news that breast cancer is far commoner in females, but then it's important to emphasize that it's also present in men, as the MD has said. I think so far this year we have recorded 3 positive cases in this hospital. So, and we still have a long way to go to the end of the year. Not that I'm wishing anything happens, but so is the reality. The next risk factor is age. People over 50. So if you are a woman around 50 years or above, that's a very big risk factor. Then genetics. In genetics and family history, the difference is in genetics, there are people that have been identified with certain mutations in certain genes in their body that predispose them and their future generations to having breast cancer. Those with family history that nothing has been identified in them, but just that their parents or grandparents or siblings have had breast cancer are also at risk. Another important thing to note is that having ovarian cancer also is a risk factor. Having other cancers in general are risk factors for breast cancers. The closer the family relation is to the individual, the positive family relative is to the individual, the higher the risk. So if it is your great-grandmother, it is less risk, you have less risk than your grandmother. If it is a sibling or even a twin, you have a higher risk. Okay? So those that attained early menarche and late menopause, those that have never become pregnant in their lifetime, or those that have not carried pregnancy to full term, those that have their first child after the age of 30 years, and those that have not breastfed. All these are related to unopposed action of estrogen, the hormones, because pregnancy, we know, interrupts that action. Okay, then these three that are downwards: obesity, alcohol, use of contraceptives, and hormonal replacement therapy, are among the few modifiable risk factors, because the MC mentioned about prevention. In prevention, there is little or nothing we can do except for this. These are the only things we can modify about ourselves. Others are, we are just born with it. Okay? So, what are the clinical features? Unlike most other diseases that alert us by pain, one of the things we should note is that pain is absent. If pain is present, usually it is a delayed presentation. So one of the first things we should note is we should not expect pain. So the first symptom that we'll see now is a lump in the breast. So a lump in the breast, you should quickly come and get it evaluated. Another is a dimple. I wouldn't know whether you can visualize these pictures very well from where you are seated. Another is a dimple on the breast. Then nipple retraction. Instead of pointing out, the nipple is now pointing backwards, inwards. Okay? So the other symptoms are nipple discharge, other than breast milk. So it is bloody, it is other colors, mucopurulent, or so you should quickly come. There is this phenomenon on the right, they call it on the left, pure orange, just like this skin of an orange. You will not feel any mass within the breast tissue, but all you will see is that the breast looks engorged and there's this shiny surface with punctured holes everywhere. So it's also a sign. So there is sudden change in the breast size or shape. It's also a feature that you should be aware of. Usually weight loss is a very late presentation, usually that of advanced disease. So, permit me to just speak. I didn't even want to go into this stuff, but for the emphasis of early detection, let's just go through the WHO clinical staging. And this one is even a very light one. They have removed most of those things that might not even be important for us now. So if you can see, it is staged from 0 to 4. There are actually 5 stages. So stage 0, nothing in the breast, nothing in the axilla. There is no lump in the breast looks normal, and in the axilla. So one will ask, how will I know? I will come to it later. Stage 1, there is a lump, very small lump, less than 2 centimeters within the breast tissue. There is no axillary lymph node. And stage 2 is you have a lump within 2 to 5 centimeters long, with or without axillary lymph node, but it doesn't advance beyond that. What to note too in stage 2, there are some that will not come with a breast lump. The only thing you see is an axillary lymph node. There is no breast lump. Okay, so it's also on that stage 2. Stage 3 is a locally advanced tumor. You have a lump in the breast, you have a lump in the axilla, and it has gone beyond the breast tissue to affect the muscles of the chest. So you will notice that the breast is not as mobile as it used to be, it is fixed. But beyond that, it has not gone to chest or other distant organs. So that's stage 3. And stage 4 is the one that have metastasized to the lungs, liver, to the bones and breast. So in this, between stage 0 and stage 2, we can achieve a cure. So the aim, once we catch somebody within stage 0 and 2, is cure. Unfortunately, most of our patients come between stage 3 and 4. That's when they present. And you can already see, based on the 5-year mortality rate, you can see between stage 0 to stage 2 is 87 to 100%, but then it goes down very much in stage 3 and 4. Mind you, this is in the best of environments. Ours is worse. We do not even have the financial capability to buy some of the drugs that they use to achieve this. We do not have some of the machines they use to detect and achieve this. So our own is likely worse than this. So the emphasis here is if we can catch somebody in stage 0, 1, and 2, we can actually achieve cure. We used to have clubs then, NYSC, the CDS groups, we can engage them. All our religious gatherings, especially the one that have women, Zumuntamata and the rest, they can create a talk, an avenue and invite anybody to go and give them a talk on that. So, I earlier said about the stage 0. How do you detect it? Because there is no lump. It's by mammography. That is the only way in stage 0 you get it. So, if you are doing self-breast examination, this is how you do it. The demonstration will be told to you later, maybe on Monday, but every monthly cycle, 3 to 5 days after the start of your menses, that is when you will sit and examine your breast every month. Then for mammography, once you are around the age of 40, especially if you have family history, you are expected to have at least 1 mammography every year, once you are categorized as high risk. So one of the biggest challenge in breast cancer management is depression, loss of members of the body, because for even anybody that will undergo amputation, whether it's a limb, anywhere, it's not an easy thing to take. Not to talk of a breast for a woman. It's a very, very difficult thing to take, especially a young woman, probably unmarried or somebody desiring to have children. So this is a very big challenge. But then you are weighing the risk against your life. And you will need a lot of people around you to really give you support. So spouses are supposed to be there with us in supporting the patients, other family members, clergy. In other places they have support groups just like they have for HIV and the rest. They have support groups where they encourage each other, they talk to them about these people that have gone through all the process will now counsel and encourage those that are just starting. And I think with time we can start that in this center. Then we have specialist counseling and psychotherapy units. They will also help because there are certain things they can do that the untrained personnel cannot do. We used to have breast prosthesis in this hospital. We had a carton of it, but I think the last one was given to one of our patients last year. So we do not have any, I don't even know where they got it from. It was from 2012, we saw it. It helps because you remove somebody's breast. One of the greatest challenges, she wears a bra and this place is collapsed. The dysmorphism just causes her embarrassment and a lot of issues. So there are prostheses. The external breast prosthesis will just gauge the size of the other breast and give you, because it's numbered 1, 2, 3. So we'll just give you one that is equal to your size. You just put it in your bra to give you semblance of symmetry. Whenever you're going, it helps. There are breast reconstructive surgeries that can be done so that the patient can live a near normal life even after removal of the breast. So how can we improve our own care for our patients here in this center and as medical personnel? We encourage training for us, all doctors, not just on breast cancers, but on others too. Training of doctors. I am aware we have up to 3 trained oncology nurses. We want to thank the MD for that. I want to encourage that we get more. Typographical. Then pharmaco-oncologists. Train of pharmacists in that specific field will really help us and guide us in dosages and administration of some of these drugs. Then for my organs department, We have challenge with immunohistochemistry in this center. Most of the times they will have to go to Yola, Gombe for theirs. If you can really get this within this center, we would be very appreciative. It will really help the patients. Some of them, the distance will just discourage them and they won't end up doing it. Then
question. And maybe before we continue, the head of department will add some few things before we entertain questions and contributions.
The things I just want to add is the age of presentation. The incident age. There's the age-related incidents of greater than 50 years. But it's good to know now that the trend of event has changed. The age is now younger than that. We have seen 15 years of age and presenting with advanced disease. The patient was diagnosed at 13 years of age, had this period of denial from her and the parents. Then at the end of the day, she now enrolled into the university, and at the age of 15, it became so obvious that this is breast cancer. So she now presented to the clinic. We saw her, admitted her. Within the space of 1 week, she started having intractable headache, and then she now lapsed into unconsciousness. And that was how we lost her. So please, the younger, the more devastating the effect of breast cancer. When this MC talked about prevention, yes, I will tell you a story of one of our, I think, artists. Most of us know her very well, Angelina Jolie, that lost her mother to breast cancer. Yes, you can do gene screening. Only that in this part of the world and country, we have started. But the only problem is that you have to take the specimen to Europe. Then you now wait for the result. It will be communicated via the net to you. We have started. In some of the institutions in Nigeria, they have started. Gene screening is very, very important. In the nearest future, the Federal Ministry of Health is also trying to key into that. In the nearest future, we'll start that. Angelina Jolie didn't have breast cancer. She only had the gene that makes her susceptible to developing breast cancer in the nearest future. Not only breast cancer, mind you, but even susceptible to developing ovarian or endometrial cancer. So she did the screening, and she was found to have that's breast cancer gene 2, that's BRCA2, that makes her susceptible of developing breast cancer or any of the endometrial cancer that are sensitive to the estrogen. That's why we said over 90% of the breast cancer presentations are among women, less among men. But mind you, even the men have estrogen, only that the androgen overrides over the percentage of the estrogen. So men are equally at risk, and when they get the disease, it's horrible because they have small breast tissue. So before you know, the local infiltration, and before you know, you have pulmonary metastasis. And the story wouldn't be that good. So she had, as part of the preventive measure, she had prophylactic mastectomy done. You can remove the breast prophylactically, bearing in mind that there is room for breast reconstruction. In fact, to tell you the truth, is that she chose the kind of breast, the size, the type she wants, with the husband's input. So you can imagine, the cosmetic outcome is just wonderful. So removing the breast, doing away with the breast, you know, that stigma shouldn't be there at all. With the prosthesis, with the fact that we can have breast reconstruction surgeries. The only disadvantage here is that lactation. Breastfeeding won't be possible in this category of patients. But that's in the interim for now. In the future, of course, you know that things can happen. Okay, so then subsequently she now had total abdominal hysterectomy. And of course, she is now free from either endometrial or ovarian tumors. So yes, when we do gene screening, it can stand as a prevention to developing breast cancer. Thank you so much. Even in this center, it's good to know that in the nearest future, this will be an oncology center. There's already a committee that has been set up that is headed by Dr. Elachi, okay, via our proactive medical director. Very soon, this center will be an oncology center, and of course, that will go a long way.
Thank you, Audrey, for that information. You will now agree with me that at the beginning of this presentation, I said breast cancer awareness is very, very crucial. I am sure the presenter has acquainted you with the reasons why early detection is important. He has also empowered you with so many things about signs, symptoms, risk factors, so that could empower us to take proactive measures. And then this awareness could also be a source of drive for funding into research for better treatment and, by God's grace, cure. Therefore, even if we are going to forget so many of the things the presenter has said, the take-home message is being a woman is a significant risk factor. Exposure to radiation, some chemical, is a risk factor. Early menses before the age of 12, late menopause after 55 years is a risk factor. Excessive alcohol, smoking, taking foods, high fat, saturated fats with low vitamins and vegetables is a risk factor. Physical inactivity is a risk factor. So if we are able to remember all these plenty things, hormonal therapy that contains estrogen, progesterone, risk factor. Not getting pregnant early, maybe before the age of 30, he has said, risk factor. So not breastfeeding, some women will say, I don't want to breastfeed, I want to buy none, risk factor. So therefore, please, let's be proactive. If you are a woman, learn to examine yourself, as he has said, every month. If you notice any change, report to the hospital. If you are between the age of 45, 54, thereabout, make sure at least you have mammography once a year, so that if there are issues, it can be detected very early. Take less or stop alcohol completely. Don't smoke. Don't take food with plenty saturated fats, less, but do physical exercise regularly. If we do all these things, it's going to go a long way to help all of us and reduce the burden of this disease on the health sector. Thank you once more again. We now entertain questions and contributions from the floor.
I want to appreciate the presenter, Dr. Michelia. He did justice to the topic, and he did very well. We want to inform the House that the outcome or the reason for this gathering is to create awareness, but not limited to the people sitting here. We should all be ambassadors for breast cancer awareness. We know clinical staff, they have little knowledge, or they have knowledge. But our brothers, sisters out there, they don't have the information. It's a privileged information. So if the number of clinical staff in FMC Jalingo will get some knowledge based on this presentation and ensure they disseminate, let's say, 5 persons out there, the information will go far. And another point I want to raise is that sometimes it's very painful that it's we, the clinical staff, that discourage other patients from accessing these services early. We have witnessed many of them. Say breast cancer is a cause, breast cancer is a charm, breast cancer is this and that. It's quite unfortunate. If you don't have knowledge of something, please refer the person where he or she may get the cure better. And second to the last point, I want to encourage the management and especially the nurses. Please, we need to go and specialize any fields, but we encourage people to go to oncology. Is the topic of the day. It's what the goal is turning around because of the burden is too much. So until when we have number of specialized people who can talk with evidence, scientific evidence, evidence-based practice, so that people will know if you are talking, you're not just saying or you are hearing it in the market. You have basis, we have evidence to present. With that, genuine information can be in circulation, and that may reduce those hearsay information that is, contributing to the late presentation. And lastly, I want to appreciate the medical director by giving us the opportunity, the 3 of us, to go and specialize as oncology nurses. We are not enough for this facility. We are not enough. So please, if you are going to specialize for post-basic nursing, please, we advise choose oncology. If we have many, yes, because the burden is too much. 10 people is not enough. We want to open, the intention of the medical director is to have functional oncology center, comprehensive, where we have radiotherapy, we have everything virtually in the treatment of the Okay, so that is the dream of the medical director. During this period as the medical director, her dream is to have comprehensive cancer care center, because all the patients in Taraba State, which we do see on daily basis, we only refer them where they can get not complete treatment. The nearest is Gombe, and some patients, they are very weak that they cannot travel by road, by the nature of the road we have. So, on that note, if the department starts, which may start soon, we hope, in the nearest future, we will start oncology department at FMC Jalingo. So 3 nurses is not enough for that department. That is why we are stressing and emphasizing to have more. It's not easy, but it's doable. Thank you very much.
Staff. I want to ask a question. The presenter, Dr. Michelia, gave us a little data of 3 men that have presented this year to this facility. I would have liked, because the usual data is that it's 1% of breast cancer cases that occur in men. If you take the whole total, that is, if you have 100, 1 should be a man. So I would have liked to see what was the data for the women so that we can compare. Are we having more male cases here? Secondly, I want to make a proposal that just as it is routine to ask a woman of childbearing age, what was your last menstrual period? How many children do you have? If we want to catch more of the breast cancer cases, we should also be asking, when did you last examine your breast? At every presentation, would you like to have a breast exam? I think if we are having higher cases in men, we should also be asking the men, would you like your breast examined? Yes. 3 is alarming to me. Because if I go by that proportion, it means we have 300 cases of breast cancer. So if we have a protocol that makes it mandatory that the clinician or whoever is seeing the patient must ask, when did you last examine your breast? I think it will help us. And would you like to have a breast exam? Thank you.
Cindy and other members of the high table, every other person present, good morning. I just want to make an observation, and most times when we come for a presentation like this and a topic is being treated, first and foremost, let me commend the presenter for this topic. It's a wonderful presentation because my department is also concerned about it. But most times when we come for a presentation like this, the other aspects will be touched and the nutritional aspect of the patients are not being talked about much, though I know it's a brief presentation. Because looking at the types of the foods we eat, they also have great impact on our lives and the kind of the lifestyle we have, especially in this part of the country where there is need for more nutritional education. So I want to actually ask, what direction should be taken when it comes to the nutritional intake of this category of people, knowing that the cancer cell is as a result of the growth of cells, and we have foods that could also help in combating them at the early stage. And then secondly, I want to also solicit that the easiest way for the self-breast examination at least should be part of this section, because most of us that are here are mothers, and then when we go back home, maybe we might also want to assist the people that are nearby and close to us. It may not be till Monday that it will be done. So I think we are mature people here. The easiest one can be taught. Thank you.
A member of the high table and other HODs, my able colleague. I want to first of all thank the presenter of this paper for the justice to this paper. And mine is just a request. The presenter, please, I want to request on behalf of the staff and other people, if you can assist us with the soft copy of your paper. That's just my request. Thank you.
I commend the nutritionist for her issue of diets. I also, you made mention of vegetables and things like that. I know I'm not an oncology nurse, but I know that people that suffer cancer, not just breast cancer, vegetable does a lot in their medication or treatments. And I know some like vegetables that actually they are zero fat and helps based on our area where we are living these days, that we don't even care. We have so many vegetables around us that we look at it as if it's for poor, and really they are not meant for poor. There are some that are not grown in Jalingo or Taraba states, but they are commonly found in Jos. There are vegetables like foreign vegetables that you see them like parsley, celery. If you are interested, even prostate cancer, it helps a lot, which I know. Roots like beetroot, we are not using them in this area, and you can blend them and it goes a long way as well. I know, look at carrots that are very common here. They are also anti-cancer and they also boost your immunity. We are not eating them because we look at it that they are for children. Look at, what do you call this? Apple. They are just at this hospital gate. 500, 700 goes a long way. An apple a day takes you away from doctor. I'm saying this because I work in this FMC, but you can never see me that I'm admitted in the hospital. I'm a living, yes. Because I love vegetable a lot and it's doing a lot in my body. I'm a living testimony. So I'm telling you today to challenge everybody you have the money, go and buy apple. If you can eat 3 apples in a week, it goes a long way. If you can buy carrots, blend them, do them. Look at that one, what's the name? That cucumber in the market. They are doing a lot. Check them, the health benefit is very important. Thank you so much. This is my contribution.
By experts. When we say self-breast examination, it's not too special a process. Wake up in the morning, stand in front of a mirror, look at your breast, try to know the normal. If you look at it every day, you will be able to have an idea how your breast look like, what is the size, what is the color, all these few things you should be able to pick, so that someday, by the time you stand in front of the mirror again to examine, if the size has changed, you will know. If the color has changed, you will know. If the nipple has inverted, you will know, because you are already used to the normal. There's nothing so special to demonstrate here. The main clinical exams, breast exam, is done in the hospital, which we advise that should be done regularly. You need to go for clinical checkup. That is the time you have access to do the real breast examination by expert. Thank you. More contributions?
I am standing here to tell us that breast cancer kills. I never know that breast cancer killed until when I was posted to female surgical wards. Most of them, they stand lama to go home because of the expenses that is involved. If not, we will have recorded a lot of breast cancer patients in this hospital. Exactly the pictures that was shown here, that is how it is. By the time it is like that, the relations will not be interested to do anything again, because they know that at the end the patients will die. So they will sign lama and go. So I want to encourage all of us that are here that we can tell our relations, we can communicate to most churches, we can tell them the importance of the breast screening, and it will help a lot. Thank you so much.
Please. The clarification I need on the presentation, he has made mention of somebody who is above 30, if she didn't get infant to breastfeed, she's at the risk factor of getting breast cancer. And to my own understanding now, if a woman delivers from 17, 18, 19 to 30 years, she's breastfeeding. And there are some women that can reach 30 years without getting married. Then automatically, if someone did not get married, if her boyfriend or a husband can suck that breast, can it reduce the risk factor?
Permit me to stand on the existing protocols. I just want to leave my voice to the issue of advocacy, because we are in a very, very distressed economy, and the cost per treatment or anything is always high. So mine is that since our proactive MD has taken the lead, we'll follow behind. The doctors, please, when you are consulting, make sure you advocate. The pharmacists will advocate during dispensing, lab advocates during investigations, radiology. By the time we are doing this, the message will spread very fast, and we'll be cutting down on this. Now, to also lean my voice to what my friend Mayanshi has raised. Yes, we are laughing about it. Now let's try to have very good relationship with our spouses, those of us who are married. Because when we have very peaceful atmosphere at home and there is good intimacy, he talked about the sucking, it's also a therapy. We have seen it, it will help. So let's not just laugh and forget his message. Thank you.
When we talk of breastfeeding, we actually mean lactation.
Okay, please, let's not be confused. Lactation, the actual process of production of milk, it has nothing to do with another person sucking. Okay? Thank you. Then, on the self-breast examination, please. So, please, let me just briefly go over it since you asked. When you stand in front of a mirror, you are expected to put one hand behind your head. Okay? The hand you put behind your head, the breast on that side is what you are to examine. So, first and foremost, you stay, look at the symmetry and the rest, but then with the put one hand behind your head, with your outstretched arm, divide your breast into 4, go to each quadrant and press with your outstretched hand against your chest wall. Go to every quadrant. Do not forget about the axilla. So if there is any lump, you have higher chance of feeling it between your fingers and your chest wall than using the tip of your fingers trying to look for it. Okay? So this is just a summary of what we are looking for. Dr. Mba asked a question about the statistics in female. Actually, the 3 that we've gotten in male is actually a very high number for this year. I can tell you that for the past 2 or 3 years, we have not recorded any man. However, on the statistics for females, we have been having a lot of challenges because of, you will see one patient readmitted several times, okay? Some, you will only see them in the clinic. Once you give them diagnosis, you will never see them again. So we lose a lot of information in registered patients. We don't register some of these patients because we lose their information. So we really have, in some centers they have cancer registry. Once you come, once diagnosis is achieved, your name enters there. I think we are on our way to that. With time, we will get that so that we'll have a comprehensive list of that. Thank you very much.
We are almost running a place. Any other issue to be addressed? Maybe the last 2.
Good morning, all. It's very, very interesting. I'm actually very happy to witness this very robust interaction with the speaker. First of all, thank you, Mr. Speaker, for giving us a very understandable lecture. So, a lot of issues were raised in terms of what needs to be done to tackle cancer, not only breast cancer. So the speaker highlighted some issues that actually concern us as a hospital management. And thank God for some advocates. I got some advocates before standing up, Yayiwa, and even the speaker advocated for us. We are trying as much as possible to ensure that we get an oncology center, even if not comprehensive, but at least triage, so that we can work with patients that come in, analyze them and refer, and then receive those that have received treatment and then continue with their treatment. It's something that we're doing. What we need to do now is to train more people like Yayewa advocated. The issue is people don't come forward. They don't come forward to present to us, and we only look out for people in terms of needs. So I also encourage people to come forward, people that are interested, so that we can see what we can do in terms of training them. That's for the nurses. For the pharmacists, I think now you send us the name of 1 or 2 people that we can train. These are very important things that we need to do. We need to put the structure in place before we actually start, so that we can start on a very strong footing, okay, so that there won't be any shaking here and there. For the physicians, we can get people to come on local, okay. All the other aspects of personnel that we need, we'll see how we can get them and make sure we start oncology. Cancer is a very serious business. It's something we need to tackle. It is just unfortunate that this axis, we don't have any strong cancer implement base, and people are looking up to us to provide solutions. So, and we need to give them the opportunity to achieve treatment, support, or rehabilitation within this environment, so that we can reduce cost. So I don't know the other things again. Then in terms of the equipment, CT scan, MRI, and then mammogram, we are trying to see how we can get these equipments are not cheap. We already have a building, the radiology complex is there, and we're trying to see how we can get it equipped and commissioned. so that the process can move on. We hope that next year, by the time we're celebrating this day, that there will be some significant progress on ground for that to go on. So, I don't know whether there is any other management issue I need to mention. This is not only for FMC, this is to create awareness. And like someone said, people here already have basic knowledge. That's why we are going out, okay, to create awareness within the town. And while during the procession, there will still be talks. And then the lady that came up with nutrition, we can't handle all the aspects in a day. And you can't bombard people with so much information. That's how we have been breaking it down. The surgeons are the custodians of these patients. That's why we decided to start with them. Maybe next year we may pick a different team, maybe nutritional aspect of breast cancer, or we can pharmacological aspect of breast cancer, or any aspect. And then we concentrate on it that year and make sure we give as much information on it as possible. But if we are going to take all of them all at once, it will bombard us and we may not take much out of it. So thank you for bringing out that aspect, but we've not forgotten it. We're just taking it all bit by bit. Is there any other thing that I've not addressed? Thank you so much for your enthusiasm. I hope you will take it to the walk. Don't collapse, please drink a lot of water. And then during the walk, there will be talks. And if you have anything to say as well, that will inform the general public, you can come up to the public address system and say what you need to say. So thank you as we move.
Thank you, Lucas, for the procession. Let's continue to interact. In a few moments.
One more shot.
zo asibiti da wuri zai samu magani zai warke. Rashin zuwa asibiti da wuri shi yake sa wannan ciwo yake kashe mutane sosai, kuma idan ba a zo da wuri ba jinyar shi yana tsada sosai. Don haka mun shirya wannan tattaki ne domin mun da al'ummar garin Jalingo.
This is Federal Medical Center out on a procession to create awareness on breast cancer. Breast cancer has consumed so many women in our country. We are out today to let the public know, to give you information about breast cancer and to tell you how this disease can be We can also advise all women also to always have a regular check of their breast at home every month. If you notice any change in your breast, either a swelling, either a lump, whether a discharge from the nipple which could be bloody, or whether you have pain that refuses to go, kindly rush to the hospital for an intervention. Breast cancer is a disease that can be managed in the hospital. Do not follow our babalawos who will tell you that it is spiritual. It is not always good to present late, because by the time you present late to the hospital, management is usually very difficult. High risk of getting breast cancer. If you are a woman, you already have a significant risk factor for developing this breast cancer. People who take lots of alcohol, people who smoke, people who don't take a lot of vegetables are all at a greater risk of developing this disease. We are out today to tell you what to do so that we can detect this disease so early so that we can intervene. You are always advised to come to Federal Medical Center Jalingo for a breast checkup. However, if you are a woman, we encourage all women to be doing regular self-breast check at home. Stand in front of the mirror, look at your breast, know how normal it is, know how the color is, so that someday when you stand in front of the mirror and see any change, you notice any change in your breast, being in size of swelling, or change in color of the skin, or maybe you observe that the nipple is bringing out fluid or blood, please kindly report immediately to the hospital for proper examination. Do not stay at home and rely on all the babalawos that will tell you that breast cancer is a spiritual thing. No, breast cancer is a disease that can be treated in the hospital. But however, early detection of this disease is always associated with good outcome of treatment. So we are out today on a breast cancer awareness. We call it the Pink Day. Taraba State goes pink. Pink is a universal symbol for breast cancer awareness. It represents support, it represents strength, it represents hope, and it represents support from us for people who are affected by breast cancer. We are out today in our pink color to demonstrate and then observe the Breast Cancer Day, which is observed every October of the year. We want to pass information on breast. We want to pass things that when you notice in your breast that will give you concern to go to the hospital. If you are a woman, you notice a swelling in your breast, you notice a lump in your breast, you notice the skin over your breast has changed, you notice that your nipples is bringing out fluid or blood, please and please kindly rush to the hospital, Federal Medical Center Jalingo, where you will be given appropriate management and checkup. So also, we want to tell you things that you will do that will also serve as a preventive measure for you for this breast cancer. If you are a woman, we expect that you should always do some physical exercises. It's very, very important for you. Take less of saturated fat. Take plenty of fruits and vegetables. Do not smoke. Do not take alcohol. All these things can predispose you to developing breast cancer. If you stay away from them, you get a better life. Whenever you notice any abnormality in your breast or pain or whatsoever, do not rely to stay at home.
Wanda Federal Medical Center Jalingo karkashin jagoranci ta shugaban asibiti wato Dr. Aisha Adamu Shehu wanda ta shirya domin sanar da al'umma abun da ya shafi sankaran mama wanda a turanci ake kiransa breast cancer. Da farko dai ya kamata kowa ya sani cewa breast cancer gaskiya ne yana nan yana addaban al'umma dare da rana safe da yamma, musamman mata, mace daga shekara 15 musamman ta balaga har zuwa ta girma shekaru 50, 60, 70. To wannan ciwo sakamakon yawan da al'umma shi yasa muke tattaki domin mu sanar da al'umma dangane da wannan ciwo. Mutane su sani cewa wannan ciwon yana kashe mutane, amma idan an zo asibiti da wuri za a bincika don a gane kuma a bada maganinsa. Ciwo ne wanda ana jinyansa kuma ana warkewa. Mutane su daina jita-jita kan cewa shi breast cancer a warkewa. Ciwo ne ana jinyansa kuma ana samun lafiya, amma abin da ake so shine kowace mace ta dinga sa hankali ta san yadda nonon ta yake, domin idan wani abu ya tsiro ko kurji ko ya canja kala ko fatan yana zafi ko cikin nono yana zafi ko kuma bakin nono yana fitar da diwa ko jini ko wani farin ruwa, to ta garzaya zuwa asibiti domin a duba. Idan an duba a san me ke damunta. Idan abun da za a bada magani ne a bada magani, idan abun da za a allura ne a yi allura, idan abun da ya kai ma a cire nonon ne domin ta rayu sai a yi. To amma rashin zuwa da wuri a zauna a gida, wannan shi yake sa mutane suke shan wahala kuma ma suke mutuwa. Da ƙarshe idan ka tashi kuma a ɗauko ka a kawo ka asibiti, wanda kuma wannan lokaci ya ƙure. Don haka jama'a su sani matsa da suke jin mu su sanar da matansu da yayansu mata domin su yi sauri su garzaya su asibitin nan domin a duba su a san me ke damun su.
Center, Jalingo. We are out on a procession to create awareness on breast cancer to the community. We want the community to know that breast cancer is a serious disease that affects our women. Breast cancer has taken away over 23,000 women in Nigeria. We are out to create awareness, to tell people the common signs and symptoms of breast cancer, and then to encourage people to go to the hospital regularly for a checkup, so that these things can be detected so early and then intervention can be made. Early detection of the disease and intervention is associated with good outcome and good prognosis. That's the reason why we are out today on this pink day. The pink symbol is the universal symbol for breast cancer awareness globally. It represents support, it represents strength, it represents hope for those who are affected by breast cancer. We are advising all women to embark on a regular check of their breast every month. If you notice any change in your breast, if you feel a swelling, if you feel a lump, or if you feel your nipple discharging fluid or blood, kindly go immediately to the hospital. Breast cancer is something that can be managed in the hospital. Breast cancer is not spiritual. Breast cancer can never be. The earlier you come to the hospital, the better for you. So we are out today on an awareness campaign to encourage all our women to always come to the hospital. On Monday, coming this Monday, there's going to be a free breast and environmental center Jalingo, so as to mark to give a support, your own support, in the fight against this menace.
Wannan ciwo ne wanda yake addaban al'umma sosai kuma yake kisa a cikin al'umma. Wannan ciwo ne wanda ana jinyansa a asibiti. Wannan ciwo ne wanda matukar ka zo asibiti da wuri za a maka jinya kuma za ka warke. Matsala guda ɗaya, idan ka zauna a gida ka ce za ka yi gargajiya kawai ba za ka zo asibiti ba, kafin ka ankara ko ki ankara ciwon ya ci jiki. To kuma jinyansa yana da tsada sosai. Don haka muna sanar da al'umma cewa duk wata mace da ta ji wani damuwa a cikin nononta, ko kumburi, ko nonon ya canja kala, ko ɗaya ya fi ɗaya girma sosai, ko yana zubar da jini, ko yana ɗiwa, ko yana sauti wanda yake hana ki bacci, to ki gaggawa ki garzaya ki zo asibiti domin a duba ki. Hakan zai taimaka wurin wannan jinya. Ranar Litinin kuma idan Allah ya kai mu, za a zo medical center idan kina so za a yi wannan gwaji kyauta wanda ya shafi breast cancer, wato screening kyauta za a yi ranar Litinin. Don haka muna sanar da al'umma ranar Litinin Allah ya kai mu su zo medical center, musamman mata su zo medical center domin su amfani da wannan screening da za a yi na kyauta. cancer gaskiya ne, sankaran mama gaskiya ne, amma in an zo asibiti da wuri ana samun magani. Jama'a assalamu alaikum, wannan kaki ne wannan
We are out today to create awareness on breast cancer. Breast cancer is, okay. My dear country people, where they for Jalingo. These people where they see for this road, now people where they work for Federal Medical Center Jalingo. Now our kwata for Federal Medical Center Jalingo, Dr. Aisha Adamushewu, we don't arrange this worker where we don't waka come here. We don't come here to tell you the disease where they affect women breast. We want to tell you, say, as a woman, make you try your every day to check your breast. If you notice, say, the skin color don't change. If you notice, say, your breast they bring out water or blood. If you notice, say, the swelling or something hard in your breast, make you kuku rush go Federal Medical Center Jalingo, where they go check you. Breast cancer, they kill so many women. It don't kill over 28,000 women for Nigeria. We no want make more women die. We want make them live longer. So make una kuku they go hospital regularly. Breast cancer no be spiritual thing. On Monday we go do free screening. We go check people. So all women make una kuku come so that una go find us for hospital. Make we check your breast. So that all of us go live long for this world. We get better life to live. Come early, make we check una, make we give una medicine. Thank you.
Let's go. Wannan tattaki ne wanda muke yin sa akan ciwon da ya shafi ciwon sankaran mama na nono, wato breast cancer kenan, wanda shugaban medical center Dr. Aisha Adamu Shehu ta shirya domin wayar ma al'umma kai akan wannan ciwo din. Kuma idan Allah ya kai mu ranar Litinin akwai free cancer screening na breast da za a yi a medical center. Don haka muna sanar da al'umma, a sanar da mata a gida su samu lokaci su zo a duba su. Idan akwai wani kumburi wato sankaran mamana wanda yake addaban mata yake kisa. Wannan ciwo gaskiya ne, wannan ciwo yana kashe mutane, amma idan an zo asibiti da wuri ana samun magani. Don haka idan Allah ya kai mu ranar Litinin za a yi wannan gwaji kyauta a medical center. Muna suka balaga su zo medical center ranar Litinin domin su amfani da wannan gwaji da za a yi kyauta. Idan mace tana da matsala a nono ko akwai kumburi ko yana fitar da duba ko yana zogi domin wayar ma al'umma abin da ya shafi breast cancer. Wannan ciwo gaskiya ne, wannan ciwo yana kashe al'ummarmu musamman mata a gidaje. Don haka muna sanar da al'umma cewa ranar litinin Allah ya kai mu za a yi gwajin sandaran mama wato breast cancer kyauta a Federal Medical Center. Muna da ita al'umma su zo a duba su da kana wannan sandaran mama yana da
We also want to thank all the participants for participating in this procession, which by implication is also one of the preventive measures for breast cancer, physical activity. I'm sure we have done enough exercise, and then we want to appreciate all of you and thank you. We are almost to the end of this memorable and wonderful occasion. But before we disperse, I would like to invite the Deputy Head of Clinicals admin to give us vote of thanks and closing remarks. And for those who still have energy, we'll draw people around to continue for them.
Okay. Well done to everybody. This has been a very interesting exercise. for us with the additional advantage of the awareness. Now every misconception must be cleared at the end of the day. And I think we've done our part for the time being, at least today. So at this juncture, I want to thank everybody, particularly the MD that has marked time out of our busy schedule to be with us today. And other members of the team, the Federal Road Safety Commission, the band crew, the Department of Nursing Services, you are prominently represented. I can see you constitute more than half of our population. Thank you so much. Okay, and to every other person that has contributed in one way or the other to the success of this program, we say a very big thank you to you. And given how well we have enjoyed the program, I hope that next year, God willing, when we come around, we all here will still be willing to participate. Thank you so much for coming, and may God grant all of us journey mercies. Thank you so much.